On behalf of TCSIN, I, Jyoti Joshi, a part of the vocational education segment, welcome you all to the session. For today's topic, which is on healthcare, you'll be happy to know that healthcare has become one of the largest sectors for the Indian economy in terms of both revenue and employment. A Niti Aayog report has predicted that the Indian healthcare sector is bound to grow on an annual compounded growth rate of 22%. That's with the pandemic opening several opportunities. The sector has the potential to generate 2.7 million additional job roles in India, with over 5 lakh new jobs per year. So, to know more about that and the recent developments that have happened in the healthcare industry, we have with us today Dr. Srinivas Rao, who's the CEO of Apollo MedSkills. Welcome to the session, Dr. Rao.
Thank you very much, Jyoti. It's indeed a pleasure to be here today. Thank you.
In fact, it's my pleasure and honor to welcome you today and introduce you to the audience. Audience, Dr. Rao is a very versatile and multifaceted doctor. He brings in over 20 years of experience in healthcare industry. So before joining Apollo MedSkills, Dr. Rao has worked for leading names in healthcare like Apollo Hospital, Siemens Healthcare, GE Healthcare, Apollo Health Street, and he has executed multiple complex global projects for them. He in fact specializes in process improvement and project delivery. And of course, content development. So Dr. Rao ensures that the content development and optimization happens, customer experience enhancement, improvement of existing systems, and delineates Apollo Knowledge's business direction and future of healthcare skilling in the e-learning industry as well. So his leadership style is result-driven, collaborated, team-oriented, and based on strong internal and external partnership. In fact, Dr. Rao is a visiting professor at IIM Bangalore and has co-authored books on hospital management and health informatics. A very warm welcome again to you, sir.
Thank you for a kind introduction. Thank you.
We would really like to hear your views about this entire thing of careers in healthcare in the current scenario in India, sir. Over to you, sir.
Absolutely. I think healthcare is always a priority sector for any country. If you look at, because every country wants their people to be healthy and they thrive on the well-being of its people. And health has a huge impact on the economy of the world. And we have seen that during the pandemic. Any challenge with healthcare will definitely have a direct impact on the economy. And as you mentioned, healthcare is also one of the largest sectors for the Indian economy, both in terms of revenue and employment. And today, healthcare as a sector is employing 5.7 million people directly. So I think it's almost the third largest employer after education sector and Indian Railways. So healthcare is almost as gigantic as those sectors. And the beauty is the sector has a potential to generate more jobs now. I think particularly post-pandemic, the numbers have increased more. Now I think it is expected to employ about 2.7 million additional people. That means more jobs will be created. About 27 lakh jobs will be created in healthcare in India in the next 3 years. I'm not talking about a very long-term vision, but this year to 2025. And almost 500,000 new jobs in the clinical roles. That means for the doctors, nurses, allied health professionals, and clinical support roles. And in addition to that, there are 350,000 new jobs that will be created in the non-clinical roles as well. This includes healthcare administrators and health insurance managers and multitude of non-clinical roles within the healthcare. So this is a humongous number, and there's a great excitement in this sector, Jyoti.
Okay, sir. It really looks like the sunrise industry. One thing that came to my mind is, why should healthcare as an industry be considered for a future job opportunity? Like you said, it is something that is there, but we wanted to get your more understanding of how and why is healthcare considered for a future job opportunities by any of the youth of the country.
Okay, sure. So I'll answer this question from two perspectives, Jyoti. One is why there are so many opportunities in healthcare. Second is what makes it exciting? So why one should choose a career in healthcare? So the question, how there is a demand here. If you see, as I told you, though the healthcare is the largest employer today, employing almost 5.7 million people directly, and I told there is 2.7 million additional jobs being created in this sector in the next 3 years. If you look at the current statistics of supplies of healthcare and demand in healthcare, as per the latest report of periodic labor force survey, okay, and also the survey by the National Health Workforce Agency, the density of doctors and nurses in India is pretty low. So today we have close to 10 physicians, nurses, and midwives for 10,000 citizens, which is almost less than half the minimum number advised by WHO. So if I bisect this 5.7 million, that means 57 lakh healthcare workers. That includes allopathic doctors, nurses and midwives, pharmacists, dentists, and also the traditional medical practitioners like Ayurveda, Unani, Siddha, homeopathy. If I take all of these together, that 5.7 million, so there are 1.16 million allopathic doctors, there are about 2.3 million nurses and midwives, there are another 1.2 million pharmacists, about 0.27 million dentists, and another 0.7 million Ayush. So this combinedly have a number of 5.76 million. So this number is, will it cater to the population of 1.3 billion of India? This is pretty low. As I mentioned, the ratios are pretty low. And what is the ideal ratio as per WHO? As per WHO, you need at least 45 healthcare professionals for every 10,000 people, but we only have 10 healthcare professionals for 10,000 people. So that's almost 1/4 of the need. So there is a demand. So what is the government doing? What is the public sector doing to address this demand? So today, the government, both in the public and private sectors, there's an addition of about 100,000 beds. And this addition is expected to continue for the next 10 years. So that means there are 1 lakh beds added both in the public and private sectors each year for the next 10 years. And if you look at the bed to human resource requirement, each hospital bed requires almost 8 full-time equivalents. That means 8 human resources approximately are required to operate each hospital bed. So that includes doctors, nurses, the medical lab technicians, dialysis technicians, pharmacists, and support workers, the housekeeping workers. But it also includes, these are the clinical staff, right? This 8 resources would also include the healthcare managers and health insurance, healthcare billing, healthcare marketing, supply chain, and other varied professionals within the industry, healthcare human resource, and so on. So there, when 1 lakh beds are added, that means 8 lakh jobs are added every year. So that's the reason I said there is an addition of 5 lakh new jobs in clinical roles and approximately 3 to 3.5 lakh new jobs in non-clinical roles in the next 3 years. It is not just next 3 years. In the next 10 years, this number is only going to rise. So this is one analogy why healthcare has so much of demand and why we need to increase. So of course, how do we increase these numbers? Doctors, nurses, allied health, these are regulated positions. That means they're controlled by a regulatory body like Medical Council of India, Nursing and Midwifery Council, and so on. But there are other non-clinical roles which are kind of MBAs in healthcare and such roles which are not fully regulated now, but there is a huge demand there. So this is on the demand side. But as a career goal, some of them would always like to serve humankind. Okay, then working in healthcare industry can become a dream career for them. If you have that attitude to help people, to serve people, then I think this is the dream career for you. And healthcare as a field is one of the most respected professions in the world, because of course everyone knows that they work for the betterment of the world. So doctors, nurses, allied health, and other medical practitioners, they always work for improvement of people's health and save lives. So, and this career is also rewarding from a monetary benefits perspective. So the job advantage of working in healthcare industry, very strong job outlook, because due to ever growing population in India, The healthcare industry is expanding, as I mentioned, 100,000 beds each year are added. And then there is variation in career opportunities. There's several varieties of work in healthcare industry. So that is one. I'll talk more about it subsequently. And there are better salary and improved benefits. So healthcare is one of the good paying industry. So healthcare job roles are very attractive in terms of salaries. And then you have a chance to help people. You have a very fulfilling and satisfying job experience. You have a huge opportunity to travel. You see, one of the biggest advantages of healthcare is cross deployment across the borders. Suddenly there is a pandemic somewhere and you need doctors, nurses, you have an opportunity to travel. And so these are some of the broader advantages, Jyoti. Thank you.
Great. That's fantastic. Sir, in fact, that is very encouraging. I have another question that came to my mind in that case. I wanted to understand, there are multiple verticals that are there within healthcare, like you talked about. Could you give our viewers a little more of understanding of what are the kind of administrative jobs? Because people, whenever they think of healthcare, it's primarily the clinical roles that people think of, doctors, nurses. But we know now that there are multiple roles. So if you could just shed some light on that, please.
Sure, Jyoti. So every healthcare institution, works with 5 cycles of operations. So it is very important for everyone to understand who enter into the healthcare industry. So these 5 cycles are the first cycles in healthcare are administrative cycles. I want each participant to listen to this carefully because this bisects the entire healthcare sector, how it operates. The first cycle or the first pillar under which healthcare operates is the administrative pillar. The second pillar is the clinical cycles. The third area is the quality cycles. Fourth is financial cycles. And fifth is the digital cycles, which is a technology cycle. So I'll go one after the other. The first one, as I mentioned, is the administrative cycles. So what are the administrative cycles in the hospital or healthcare industry? Just imagine you visiting a hospital, you find a security guard, right? So security management is a very exclusive thing within healthcare, because security in healthcare are not like security in a bank or a security in any other retail organization or any other institution. Security in healthcare are expected to learn certain kind of protocols. They all learn basic life support as a protocol. They learn the disaster management. So security management in healthcare is one administrative cycle. Then you go and see, you find a front office. So front office management, you will find front office managers, you find operations managers, patient care attendants. This is the second cycle, which is the front office management. The third in administrative is human resource management. You have to manage multitude of people within the organization, right? So you have doctors, nurses. So HR is required in any organization, and same is in healthcare. You require supply chain management. So it's a very procurement intensive industry. Hospitals require a lot of procurement, be it cotton to medical devices to whatnot. I think it's a very huge procurement opportunity within the hospital. So procurement and supply chain management. Then you have marketing within the hospital, marketing as a department within the hospital, because you have to be visible in the markets in order to sustain in the industry. So these are some of the administrative cycles, right from security to some of the areas that I have mentioned. Now, then the second pillar is the clinical cycles. The clinical cycles are emergency department. So you have emergency management, you have intensive care unit management, that is ICU management. You have outpatient management, you have inpatient management, that means wards and so on in admission. You have pharmacy management, you have nursing management. So these all are clinical cycles within the healthcare system. That's the second pillar. And most of them equate hospital as these clinical cycles. But hospital has multiple, as I mentioned, 5 cycles. The third cycle is the quality cycles. So just like any other industry, like for example, the IT industry has a CMMI, ISO, and multiple other quality cycles, right? Healthcare as an industry also has quality standards. And there are 2 popular standards. One is NABH, National Accreditation Board of Hospitals. Second is JCI, Joint Commission International. So this is one thing where you require non-clinical professionals mostly to manage the quality, patient safety, infection control within the hospital. That's the quality cycle. The fourth is financial cycles. So, what are financial cycles? Hospital product pricing. You must have heard that in this hospital, say angioplasty as a procedure, the package is 25,000 rupees. So, how do we arrive at that? So, there is a finance department which will work on costing and pricing, right? So, there is a payroll management, which is again finance. Then you have uh, the digital health insurance management, which is again dealt by finance. So in financial cycles, you have payroll, you have hospital billing, hospital pricing, and you have health insurance management. Then finally, digital cycles. So you have a lot of medical devices, as I mentioned, in the hospital. You know, CT scan machines, ultrasound machines. A lot of data flows between the doctor's office, which is outpatient, to the laboratory and to the radiology and multiple departments. So you must have gone, if someone goes for a CT scan, the report appears on the doctor's screen. So there's a lot of technology also involved. So the point that I want to impress upon all of you is hospital is not just about doctors and nurses. Hospitals have security, hospitals have front office managers, hospitals have HR, hospitals have hospital billers, hospitals also have quality management professionals, technology professionals within that. So healthcare as an industry is not confined to clinicians. The second point that I want to make is these are 5 cycles on which they run, right? The second point is healthcare is a very broad term. Healthcare is not hospitals. Healthcare has multiple sub-industries under it. When I say healthcare, healthcare includes hospitals, healthcare includes health insurance companies, healthcare includes medical tourism, healthcare includes medical device companies, healthcare includes the new health tech startups that are coming up like Practo, and these all are part of healthcare. And healthcare in a broader sense also includes pharmaceutical industry, and it also embraces a lot of life sciences industry into it. So it's a very, very broad sector. Okay. Thank you, Jyoti. I think
that's really a lot of information, sir. Emerging career options that are coming out, basically kind of the roles that are available in healthcare institutions, hospitals, and other verticals that you just shared about. If you could just give us a little more in detail about these, so that our participants can also understand specific areas that are really growing now. Over to you, sir.
For every industries, when there are new roles emerging, there could be some key driving forces for the new roles that are emerging. Okay, so similarly in healthcare, apart from the hospital roles that I just mentioned, I talked about, there are multiple other factors that are influencing the new roles within healthcare. The first one is change in the consumer behaviors and disease patterns. When I say change in consumer behaviors, we all are highly influenced by home delivery revolution. You want food with Swiggy, you want a cab from Ola, Uber, and whatnot. There are multiple apps around, and you want everything at a doorstep, right? So the same thought process is also existing in healthcare. People want the healthcare services to be delivered at home. So that's the reason you have a huge demand for phlebotomy technicians. When I say phlebotomy technicians, the one who collects blood samples from home, the one who collects laboratory samples from home. There's a huge demand for phlebotomy technicians. Today, almost 70% of the samples, the blood samples, are collected from home, and only 30% are collected at the hospitals. That means you can see how large this industry is as the medical diagnostic industry. So a technician who collects blood and lab samples from home. The second is home health aides. Earlier, if you have a senior citizen at home and ill, if he's seriously ill, obviously you have to take him to the hospital. But home health aides are in big demand, and particularly for the senior citizen care and also after discharge from the hospital. So home health aid is next area where there's a big demand, and it is again the change in the mindset of people. Similarly, because of this change in thought process of consumer behavior, there are new roles like rehabilitation aides. You want physiotherapy at home. You want medicines to be delivered at home. So pharmacy assistants, 1mg, PharmEasy, multiple platforms coming. So you want medicines to be delivered at home. Then similarly, fitness instructors at home. You see Urban Clap, large number of fitness instructors posted there, right? So these are some of the new roles emerging because of the first driving force, which is change in consumer behaviors. The second driving force is change in cultural patterns. there's a lot of change in the cultural patterns in India, which is leading to new roles. For example, with rise in nuclear families and increasing trend of urban, interstate and inter-country migration, many of them are going to US, UK, settling there, or someone from Delhi coming and settling in Hyderabad, someone from Chennai going and settling in Delhi. So a lot of movement of people because of jobs. This led to a new breed of professionals called geriatric aides to take care of senior citizens at home for whose children are actually away from home. The second is neonatal aides. Neonatal aides to help young mothers in nuclear family in taking care of the newborn babies. For example, supporting in feeding, giving bath to the neonate and post-feed care and so on. So this is the second driving force, change in cultural patterns. The third driving force is change in technologies. So technology adoption has been accelerated during COVID. We have seen a lot of adoption for telemedicine, and there's a wide gap. There is a very wide gap between rural and urban healthcare, and telemedicine is trying to bridge that gap effectively. The second is there's a need for data analysts and artificial intelligence professionals in healthcare. Also, change in technology is another driving force. And of course, there's a need for a large upskilling of existing resources also, because there's new technologies, new medicines, new treatment protocols, new medical devices. With this, the healthcare professionals also have to get trained on these new trends in healthcare. So upskilling is also one new thing that is emerging. So
I think that's very encouraging, sir. Good to hear. While we're talking about saying, various upcoming roles which are there, but, like we all know that post-COVID, there have been quite many changes that are there that have happened. In your opinion, sir, do you see any added future skills or competencies that students need to focus on or be better prepared for upcoming opportunities in this sector, sir?
absolutely, I think every healthcare professional, there are certain skills. During during pandemic, during COVID, there are certain skill gaps that have been identified, and every healthcare workers have to upskill in that area. Okay, the first, be it a doctor, nurse, allied health, or a paramedic. So the first one is disaster management and pandemic management. So this is one education which is not part of any curriculum in healthcare. So there is an imminent need to train the healthcare workforce on healthcare disaster and pandemic management, so that they understand if there is a surge of patients at once, so how to handle them, how to prioritize, how to triage them. So these are some of the skills that everyone should learn. The second is public health. So today, the countries in South Asia have less than, second area is public health. So in Southeast Asia, there are less than 5% of world schools of public health. That means 95% of public health education happens in US, Europe, and rest of India, rest of Asia, in fact. So there are very less institutions that teach public health, but the Southeast Asia houses 1/3 of the world's population. So I think there's a need for public health training, both in the medical schools, in the nursing schools, and all the healthcare institutions. The third area is emergency and critical care skills. We have seen a huge gap in this area. Skills such as advanced life support, oxygen, rational use of oxygen, ventilatory management. So these are some of the skills that need to be mandated across all healthcare professionals and every year. So there need to be a continuous education and continuous learning strategy in these some of the critical skills, so that the clinicians get their credits and they get their license renewed. So today that is not happening, but I think this is one big area. And in terms of new skills that have emerged, the demand has surged post-COVID. Particularly, I mentioned about phlebotomy technicians. The amount of RT-PCR samples, the amount of post-COVID samples that were collected were humongous. So the technician need, the lab technicians as well as phlebotomy technician need has surged. Then telehealth coordinators, the resources who actually can manage the telemedicine technologies and connect the rural patients with the urban doctors. So there is a new breed of profession called telehealth coordinators. Then I mentioned about home health aides, geriatric aides, then retail pharmacy associates, retail sales associates in pharmacy, and of course upskilling and kind of need for upskilling the nurses. So we have also designed a special program called FINE, which is finishing skills in nursing excellence, in collaboration with TCS ION, because we wanted to blend
That sounds appropriate, sir. That sounds very appropriate. How can healthcare training and we have some institutes who've joined us. How can these institutes leverage this kind of an opportunity in terms of infrastructure, training modalities, methodologies, and things like those? So, if you could just share some more points on that, sir.
Absolutely. If you see, if you see the current investment trends in the market, there are two industries uh, where there is a very heightened interest in investment, both by the government as well as the private sectors, private investors. This is edtech and health tech. So, both in the education technologies and healthcare technologies. And healthcare skilling is a combination, healthcare training is a combination of both edtech and health tech. So, what I mean by that is you need a technology for delivering healthcare education, but at the same time, you also need a physical infrastructure, you need some experiential learning in a clinical setting. So, there must be some of the vocational training institutes who must be willing to get into healthcare training. So, just few advices for them. So, prior to pandemic, we have seen traditionally the healthcare learning has been brick and mortar delivered in the classrooms, but there's a lot of advantages that healthcare training and healthcare skilling has also seen in blending the learning. When I say blending the learning, in adding the technology solution to their traditional classroom based learning. So we have seen marriage of many edtech companies with the physical infrastructure companies. One such popular one was Byju's with Akash, right? Akash had this center. Similarly, Amazon with Sri Chaitanya, Amazon education with Sri Chaitanya. So these are very large acquisitions that have happened. So that means there is a benefit of both. So I will talk about specifically from the healthcare industry where this benefit comes from. So in healthcare, all the education has basically three components. One is a theoretical component. Then you have a simulated learning. That means you mimic a real environment and learn on in that environment. The third is on-job training, which is where you go onto the field or you get onto the hospital in this case or to a diagnostic center and work there and learn. So these are the three components. So the theoretical component today can be done online. That's where I think TCS ION and Apollo have collaborated, Apollo MedSkills have collaborated. So where TCS ION brings their strength of the digital learning technologies and we bring our strength of experiential learning, both with simulation as well as on-job training. So for the vocational institutes who are actually interested in partnering, I think TCS can bring in that technology leverage, and you with infrastructure with Apollo MedSkills being partnering with them, we can get some of these advantages like training your trainers on healthcare, giving the knowledge transfer on how to train a healthcare resource, knowledge transfer on how to set up clinical laboratories within your organizations and convert your training center into a healthcare training center, because healthcare being a high demand, and one of the challenges that healthcare skilling is facing today is lack of infrastructure also. So I think there's a need of lot of infrastructure to build labs, to build trainers. Lack of trainers is a second challenge. So training the trainers is another thing that we can work together. So broadly, what I wanted to convey is there is a huge demand in healthcare, and the institutions which already have infrastructure can leverage this opportunity. And the training methodologies, both tech methodologies by TCS ION and the clinical training methodologies by Apollo MedSkills, can be transferred as a knowledge to anyone who is actually interested to join this revolution. Thank you, Jyoti.
That's great, sir. That's great. जैसे आपने बोला कि हेल्थ केयर में लोगों की तो जरूरत है ही, बट उनको सिखाने की जो इंस्टीट्यूट्स हैं उनको भी अपने में इंफ्रास्ट्रक्चर बिल्डअप करने की जरूरत है. जैसे आपने कहा कि it is not just the requirement of theory which can be dealt online. It is more of a requirement कि जिनके पास, जिन ट्रेनिंग इंस्टीट्यूट्स के पास ऑलरेडी इंफ्रास्ट्रक्चर है, वो इनको हेल्थ केयर इंस्टीट्यूट्स में कन्वर्ट कर सकते हैं. एंड एज अ पार्ट ऑफ अपोलो मेड स्किल्स, you also are saying that train the trainer is something that we can help them on. because that's also a large requirement. Trainers की बहुत ज़रूरत है. We get that entire point that is there, sir. Sir, while we are doing this entire thing, we've also heard of something called as the NDHM, which is the National Digital Health Mission. So, can you just share your thoughts on that, and how can it be beneficial for the healthcare industry, especially from the job creation point of view, sir?
Absolutely. I think that's a very very futuristic movement by the government of India, and it will create future jobs in healthcare. So the main goal of National Digital Health Mission as a scheme is to make India a digital health nation and also enabling digital healthcare for all. So what does it mean? That means every citizen will have access to their medical records, electronic health records, one. So there'll be digitalization of healthcare systems. So currently, if you look at, it may sound like, okay, we are talking something very futuristic, but I want to just inculcate some knowledge into what's happening around us. So if you look at current public digital infrastructure, okay, everyone, each one of us, most of us have an Aadhaar card, except barring couple of states in the northeast. I think everyone has got an Aadhaar card now. So most of us know what is a UPI payment. Everyone knows what is a Paytm, what is Phone Pay, what is Google Pay. And we also have a wide reach of internet and mobile phones. So there is an Aadhaar, there is a unified payment, there is also an access to smartphones. So this provides a strong platform for establishing building blocks for National Digital Health Mission. So if you have these three things, you have an Aadhaar card, which is a unique ID, you have a UPI, which will enable the digital payments. You also have smartphones, which is a hardware that will enable it. So the existing ability to digitally identify people, doctors, health facilities, and facilitating electronic signatures, ensuring digital contracts, making paperless payments, securely storing digital records, and we have DigiLocker, which securely stores the digital records, right? So there is a public digital health infrastructure already created. These things which are non-healthcare, I've told just to tell that there is a backbone that is already existing. So what Digital Health Mission is looking at is to piggyback on this existing public digital health infrastructure and build on it. So what is the first step towards National Digital Health Mission? What is government doing now? So we all know that Government of India is also planning to have universal healthcare. What is universal healthcare? Universal healthcare means giving free healthcare access to every citizen in India. Today in phase 1, the Ayushman Bharat as a scheme, which is Pradhan Mantri Jan Arogya Yojana. You must have heard about PMJAY as a scheme. It has successfully used the available public digital infrastructure in many states. I think it was implemented in over 15 states now. In all the states, they were successful in using the public digital infrastructure. So now coming to what did they do there? Okay, so today, when a patient goes to a government hospital, the records have been paper, like we used to get a paper discharge summary, a paper OPD slip and all. So in phase 2 of Ayushman Bharat scheme, today Ayushman Bharat is just seen as a reimbursement scheme, like someone going as a patient and he gets a free service and then the patient comes back home. But in phase 2, you will have a digital record linked to your Aadhaar, your digital health record. So what happens? There's a humongous healthcare data that will be available. That leads to, once there's a huge data, then there'll be a data science that will be applied on it. So this data will be stored on servers and this data will be analyzed. So then there comes healthcare machine learning. One, healthcare data mining, healthcare machine learning. Once machine learns, then when you learn, it's a natural intelligence. Once machine learns, it is an artificial intelligence. So machine learns and applies that artificial intelligence and starts giving ideas to the healthcare professionals that, okay, in Warangal or in Varanasi, thyroid is endemic. So it starts throwing some statistics to the clinicians about, this is a very simple example, but multiple complex digital support systems will come, clinical decision support systems. So that's the future. So what does it need? What does it does for employment? What happens is you will require a lot of medical billers who can digitally bill. you need a lot of medical transcription professionals who can digitalize the existing records. You'll require a lot of medical coders to code the disease, to code the procedure that is done in the hospital. You must have heard about a profession called medical coding. Medical coding today we see is existing in US, UK, Singapore. Why in these countries? Because those countries have universal healthcare. If you have universal healthcare, then you have to code your disease and you have to maintain digital records. So this leads to new breed of professionals. The digital education in healthcare will lead to medical coders, medical AI professionals, healthcare data science professionals, and every doctor, nurse, and everyone have to learn certain digital skills as part of their core education. So
There is a participant who's mentioned saying that I'm an ITI electrical pass out. How can I build my career in healthcare, sir? One of the participants has asked.
Yes, if you are an ITI electrical pass out, there are opportunities in two segments in healthcare. One is hospitals, because hospitals have a huge biomedical engineering department. Okay, so there's a lot of electrical and electronic work as part of servicing of a medical device. Okay, so that is one area, but you need to do some training on biomedical instrumentation after your ITI in electrical. The second opportunity exists in medical device industry. Okay, so there's a need for huge number of medical device technicians and hardware technicians who come from electrical engineering and ITI electrical background. Okay, so these are the two segments where I see opportunities for you. May I know what's the name of the party?
There's a participant who is asked saying that I've not taken up science after my 10th. Can I do something more in healthcare industry?
Yes, certainly. So it's not that you have to do only biology. You have to do only biology if you have to become a doctor, nurse, or a lab technician. But for rest of the roles in healthcare, you don't need biology at all. Okay, so that means if you have to become a CEO of a hospital, there's no need for you to do a biology. If you have to become a finance professional in a hospital, there's no need to study that. If you want to become a front office or customer support professional in a hospital, anyone can join in. But as I mentioned, across those 5 pillars, if you are a HR professional, you can join in HR. If you are coming from a finance background, BCom background, you can join either finance or the procurement or supply chain within the organization. So if you are coming from, say, IT background, you can join the technology area of the hospital with humongous data and digitalization happening. If you're an engineer from IT background. So multiple people have opportunities within the healthcare industry. And myself, I am a doctor, I am a technologist, I also did my management degree. So there's opportunity everywhere here.
There's an opportunity to grow vertically as well as horizontally.
Exactly.
Absolutely. In fact, sir, we have a very interesting question, very slightly different from the rest that is there. We have Muhammad Shabir who's asking us, saying that, what is the opportunity of counseling psychologist in the health sector, sir?
Now, this is, if you see, Muhammad Shabir, it's a very, very relevant question to the recent times. This is something that I have not mentioned in the future skills, but this is one of the largest emerging future skills. So as per WHO, World Health Organization's definition of health, so health is a state of well-being of both physical, mental, spiritual well-being, right? Health is, you have to be physically fit, mentally fit, and spiritually also you have to be fit. So most of the times we only focus on our physical health, whether how do you look, are you fit, are you what are your body kind of diagnostic reports saying. But mental health is something that was highly ignored in this country, at least in this part of the world, significantly. But I think now people are coming out. Earlier there was a stigma associated with someone going to a psychological counselor, a psychiatrist, but today they're one of the most demanding professionals, both psychologists and psychiatrists. It's because of various factors. One is because of more education that is happening. One. Second is, of course, because of the stress that we are facing in our regular roles. And also the, stress tolerance, tolerability has come down. Okay, so this is also one of the factors. So multiple factors. Now there's a huge demand because people are coming out to consult psychologists, to consult psychiatrists. So this is one area which has a huge demand, Shabir. Thanks for bringing this out. So there's always a learning from participants also for the speakers. Thanks for bringing it out.
In fact, sir, there is Danbar who is asking a follow-up question to our previous one, sir. He's saying that he's passed out of the electrical department, but he passed out nearly about 10 years plus back. So he's saying that what are the opportunities for people who are not freshers? Do they have an opportunity to join?
Absolutely. So just that Deepak Dhanwar, right? Dhanwar Deepak.
Danbar,
So,
yes.
so Dhanwar, what happens is whenever you are switching over your jobs or sectors, you need to upskill yourself in that sector. Okay. And you have to upskill in an area where there's a synergy. Suppose if I have to go and join NDTV, okay, you must be wondering why will I go and join as a doctor in NDTV? But I have an opportunity in NDTV to join as a medical journalist. That means I have to study journalism, and whenever there is a pandemic somewhere, there's an outbreak of dengue in say Delhi, then I will go as a medical reporter and report, because I can speak about dengue better than the regular journalist, right? So similarly for you who have done an electrical engineering, how do you connect with healthcare as an industry? You'll connect if you do either a medical healthcare management degree, if you want to enter into management related roles, or you have to get into the AI, data science, or healthcare biomedical engineering degree. So if you upskill yourself in one of these areas, then you have an opportunity there. Okay. So I know you have 10 years of experience post your education, but still you need to upskill if you have to enter a new sector.
And with the kind of opportunities that you have already told us about, I think that's a great thought. It would trigger some of the evaluation of looking at taking it forward. In fact, sir, I am getting many questions on medical coding. I think that is coming up. At least 4-5 people have asked, saying that, can you tell us more about medical coding and how that is going to be the future?
Yes. So what happens is, so for everyone, we know that I mentioned that wherever there's universal healthcare, there is medical coding. What do I mean by that? Whenever there's universal healthcare, what happens? You as a citizen of India, for example, if I am a citizen of US and I have a green card, I go to a hospital, I fall sick, I'll go to the hospital. So what is the equivalent of green card here? As of now, for us, it's Aadhaar card. I'll go with my Aadhaar card to the hospital. They will scan my Aadhaar card and they will generate a UHID, because with PMJAY, which is Ayushman Bharat, there'll be a unique ID generated from Aadhaar card. When I go there, if I get treated, suppose if I am going to say Gangaram Hospital in Delhi, is scenario 1, and I am going to say Apollo Hospital in Delhi, scenario 2. Whether I go to Gangaram Hospital or to Apollo hospitals with say pain abdomen on the right side, so say my diagnosis is appendicitis. Okay, so government has decided that for appendicitis we are going to pay 30,000 rupees. So how does government do that? We are not going to give a physical file back to the government, someone verifying it and again paying you back in a check. It will not happen anymore. What happens is, you will put the electronic health record and the tagged Aadhaar number to the government and the code of the disease. So why you need code of the disease? Because finance department will not know that you have gone with appendicitis, right? That's the reason you need to code the disease. So the system will read the code. For every medical code, there is a reimbursement value. That means if you are admitting with appendicitis, there is a reimbursement value of say 30,000. If you are admitting with migraine, there is a reimbursement value of this say 5,000 rupees. If you are admitting with say a cholecystitis, a gallbladder disease, then there is a reimbursement. So like that, there are more than 80,000 medical disease codes. Okay, so that means for every condition, for headache there is a code, for a pain in the thigh there is a code, for cancers, various cancers there are codes. Based on that, there is a reimbursement value. So that is what is code. So you have to code. So there are two kinds of codes. One is CPC, which is certified professional coding, There is ICD coding, which is International Classification of Diseases coding. ICD is most popular coding system that is used. The second coding system is CPT, which is Common Procedural Terminology. So you have to learn those coding. That is what is medical coding. If you learn that coding, then you will get jobs in medical coding companies and in future in the government as well, because government would need a lot of coders to code these diseases. Hospitals would need coders because the patients who get admitted in their private hospitals, they want the diseases to be coded for the reimbursement.
So I think that's has been a very, very engaging session because we've had many participants who are still asking. Thank you for taking out time for sharing all these new, interesting, futuristic as well as much required information in the healthcare sector with our participants. Thank you so much, sir.
Thanks,
Thank
Jyoti,
you.
and I would like to thank all the participants for really being engaged in the session for quite some time. Thank you very much. Bye bye.
Thank you. Thank you so much, sir.